For those of you who don't know me, my name is Sanjay Iyer. I'm a movement disorders neurologist. I've been here in Charlotte for a little over, I guess, about 15 years, and joined the Memory Center Charlotte about 2 years ago, and now we are known as Memory and Movement Charlotte. In my practice, I focus predominantly on Parkinson's disease, although I do see a lot of other movement disorders. When I was asked to be part of this session, the question was, can I think of a caregiver who I would like to partner with? And, it took me about 2 seconds to think about my friend, Roy Weinberger. It's a pleasure to be doing this with you, Roy. I met Roy and his wife, Wendy. Gosh, it's been about 10 years now. They were in the process of moving here from Georgia, where I grew up, and which is why I'm wearing my Atlanta Braves jersey today for Spirit Day. Go Braves! We're doing Spirit Week. We're doing Spirit Week in our office this week, so it's kind of fun. So we do some silly things, but it makes it fun. But I met them as they were deciding to move here from Georgia. Their daughter lives here in the area, and when they were looking around for Parkinson's care, they came across my name, and we had sort of an instant connection just with our background in Georgia. And Wendy, who we unfortunately lost around Christmas time last year, was an amazing lady. She Roy will tell you all about her, but what really struck me about Roy is how he so advocated for her. He had a knack for not only learning about the disease state, but the medications and how to sort of do certain things. But he would always come back to me with a lot of good data. He would write down, what time did we take the medication? When did these side effects or good effects start? All the things that really help me make better medical decisions. And those are the kinds of things that I want all of our patients and loved ones to be able to do, because that helps us take better care of you. And Roy, I've definitely have admired the way you took care of Wendy, how you advocated for her, and would just like for you to introduce yourself, tell us a little bit about you and a little bit about Wendy, and then we'll kind of get into the program.
Okay, well, thank you very much, Dr. Iyer. My name is Roy Weinberger. My wife, Wendy, was diagnosed with Parkinson's, I think about 12 years ago, maybe, 12, 10, doesn't really matter at this point, but about 12 years ago. And she and I, along with Dr. Iyer, pretty much took the entire journey together. As Dr. Iyer said, Wendy passed suddenly last December. The medical diagnosis was a brain aneurysm, but I think that the never-ending stress on her body due to Parkinson's was a major contributor. In any event, for the first 5 years after the diagnosis, the meds worked perfectly, which I think is, as I understand, is fairly typical. No side effects to speak of, and no one even really knew that she had the disease. Unfortunately, then the meds stopped working so well. We spent the next few years changing meds or tweaking them, and Wendy experienced, side effects like nausea and alternating hot and cold episodes. We did finally find a workable balance with the meds, but meanwhile, the disease seemed to be progressing. She had serious balance and other issues, and on her own, fortunately, she decided to stop driving. On the other hand, we found some new outlets, of which I'd highlight Rock Steady Boxing, great both for the exercise and for the camaraderie to try and keep moving forward. As I said before, it all ended suddenly last year. A few months later, Dr. Iyer and I asked if I might be interested in working with the already established caregiver support group of MMC to share my experiences. I was happy to do so, and here we are. I'm sure I'll refer to Wendy a little bit further in an answer to various questions, but I think we'll stop there in terms of an introduction.
Thank you, Roy. Again, my pleasure and my privilege to be doing this with you. I thought I'd give just a very, very short overview of Parkinson's disease. What is it? Parkinson's is a condition that causes what I call visible symptoms and also invisible symptoms. The visible ones relate to movement, or what we call the motor symptoms. We sometimes see tremors or shaking of the limbs. The movements can become slower, stiffer. We often see trouble with walking, shuffling of gait. Those are most of the visible symptoms that people will recognize, but there's also a whole host of invisible symptoms or non-motor symptoms that we talk about that sometimes are even more disabling. These can be things like anxiety and depression, blood pressure fluctuations can be really problematic, constipation. We see sleep disorders. A lot of different things can kind of pop up. But, as we kind of think through what all the signs and symptoms are, I try to review a lot of this with, with my patients and their care partners is sort of the term I prefer. Because what a lot of folks will see is that, different things happen, different symptoms occur. Is it the Parkinson's or is it something else? Is it the medication? Is it something else? And so I think just having a basic understanding of what the disease process is helps people, better communicate with me, because ultimately that's where the rubber meets the road. It's the communication between families and the providers. And if we're not speaking the same language, then it's hard to know what to do and hard to understand how to help. When we think about the treatment for Parkinson's, for the movement related symptoms, dopamine replacement in the form of typically levodopa is the mainstay of treatment. Dopamine is a chemical in the brain that modulates movement. It also controls all the other stuff we talked about. But when the dopamine gets low, that's kind of like draining the motor oil out of your car engine, and your movements get slow and choppy and sputtery. And so we try to replace it. Now, the things that become important are, when you take your dose, how long does it take to kick in? How long does that dose last? Most people can feel the medicine working, and when it's working, they're moving well. When it's not working, they're not moving well. And so understanding how long each dose lasts helps us understand when to dose it, how often to dose it, how much to give, and those types of things. Again, every patient is so different, and that's really important to know. I have folks who come to me all the time and my neighbor just started this medicine and they look great. Can I try that? And, we'll often talk about, well, your neighbor has a certain set of symptoms. I don't necessarily know what those are. In that situation, perhaps it's a good thing. In your situation, maybe it is, maybe it isn't. But just to understand, it's very different in everybody. And, what I always was amazed with was, how Roy would come back with such good information. And, early on, I don't know that we necessarily spent a lot of time, Roy, kind of talking about these things.
No.
But you were, I think from your background, your analytical mind, you somehow either had that inside of you or you realized you had to do something different to be able to communicate with me on a level that would help Wendy better. Do you want to talk a little bit about sort of, where that came from, what your approach was, what you were thinking?
Okay, thank you again, Dr. Iyer. I appreciate your thinking that, I was good at doing this and that I was a successful advocate and caregiver. But honestly, even today, I feel guilt that I could have done things differently and better, especially, shown more patience and empathy. On the other hand, I think we can all agree that no one is really schooled to be an advocate for a loved one. It's really all on the job training. But full disclosure, this really wasn't my or our first rodeo, actually, because our son Blake, when he graduated from university, developed a serious colitis and actually required surgery and had a bad reaction to that surgery developed sepsis, and we almost lost him. He was in the ICU for several weeks, and actually he was in the hospital for just about 100 days. So that certainly required a tremendous amount of advocacy on both Wendy and my parts. Of course, advocating for him in a hospital setting, and advocating for Wendy, experiencing the Parkinson's as she did over a extended period of time, were very different experiences. So in thinking about it, I would say, at least in part, the ability of someone to be a successful advocate quickly or at all depends on how their prior personal and work experiences condition them. As you suggested, Dr. Iyer, I was and am a financial investment analyst. We're digging into problems, doing research, keeping detailed records, asking questions, and being willing to argue, for your point of view, are necessary attributes for success. So, maybe I have a bit of a leg up, for relative to many people in at least having some of the tools that are helpful, in doing this kind of thing. But, as you say, at the beginning, we had conversations, lengthy conversations about what could be done and what should be done. And, for the most part, again, for the first 5 or, even a little bit more than 5 years, everything worked well. So we didn't, need to get into in-depth what ifs type of a thing. And, of course, even during that time, we were hoping, for the the magic solution, but unfortunately, it never came for Wendy. I know there were some positive developments and treatments and whatever, but unfortunately, she always seemed to be the 1% that didn't react positively to new drugs. But we kept trying. You kept thinking out of the box, and we kept trying new things, and that's really made it all worthwhile. So I don't know that I can offer any more as to what why you perceived me as successful, or why I was. At the end of the day, it was what it was, and I brought the skills and the attitude that I had to the table, and I think the other, I guess, and just in terms of one specific thing, which again I certainly did not do in my business world, but I actually on a few occasions took videos with my smartphone, to show you how she was in fact reacting to different situations, different medicines, and so on. Because as we discussed before, she was at heart an actress. I mean, she could put on a show, and when we would come to your office, no matter how she was feeling, she really, she got up for it, and somehow there was a lilt to her step, or the way she expressed herself was not necessarily how she was as we were driving to your office, or as even as we were driving home. Although driving home, we always felt better having seen you, no matter what the situation was. We always felt it was good that we met with you and and had the conversation. So a picture says 1,000 words, right? And so I think that's a useful possibility for anybody that is having difficulty expressing what they're seeing themselves, is to take a short video to show what's going on.
That's a great point. And in my world, movement, it's such a visual, and the videos are worth 1,000 words. And Wendy certainly had a unique spirit about her, and as Roy said, I mean, she would come to the office. She always had a smile on her face and a great story to tell me, and she was always up for the event. But the fact that Roy could bring some objective data, some videos to show me this is what she actually looks like when when she's at home, and these are the things that are happening. It really helped me understand not only what were the biggest challenges, but sort of when were they happening, and was this a medication side effect? Was this not enough medication? So those things are, I think, really helpful to have. Bring as much data as you can. A lot of folks will come in and they we'll sit down and we'll talk about what's been going on the last couple of months, and they say, oh gosh, I left the list at home, and but there were all these things I wanted to talk about. But I encourage people, make a list, take some videos, bring data, because data is actionable. That helps us make better decisions, and that's something that it was always helpful. I mean, as Roy mentioned, we tried some really outside the box sort of things, and I always had the disclaimer that, okay, this is going to sound a little bit crazy, but this is what I'm thinking we can try. And Roy would go home and read about, the crazy idea I would have, and he would send me his feedback and say, okay, I understand what you're getting at. Let's try it. And then I'll give you back some data. So I feel like we kind of established a good relationship that way to be able to communicate about what the expectations of a treatment were, and whether we were meeting them or not. And so I think that was definitely helpful. Now, I guess when we were talking a few weeks ago, Roy, we were having a conversation about some things that we might talk about tonight. You made a very interesting comment, and I was hoping you might sort of elaborate a bit. But you made the comment that that you felt some resistance to consider yourself a caregiver. I mean, I wonder if you might comment a bit about that.
Sure. Yeah. So rightly or wrongly, I had always thought, in the back of my mind, that once a person became a caregiver, it was pretty much a permanent assignment. There was no going back from that situation. Again, that was just my thought going in, correct or incorrect. And honestly, also, for a very long time, I held out hope against hope that with the proper medicines, the proper therapies, or whatever, we'd be able to go back to the way things used to be. In addition, I would just say that, Wendy herself fought very hard to remain independent. I mean, she did not want to, give up things that she felt she could do, no matter how hard they might have been for her. But, in the end, basically, I had to accept some, hard realities. And so, at some point, I accepted it and stopped resisting it, and I guess you could say embraced it. Not that I didn't embrace it even while I was resisting it. I was still doing what I felt needed to be done. But again, hope springs eternal until it doesn't.
One thing that Dr. Edwards often talks about is the concept of the stages of caregiving, the stages that caregivers go through. One thing that we want to start to focus a little bit more on are the things where, in your situation, Roy, where we lost Wendy last year, and there's a certain period of time that you have to go through, the mourning period, trying to figure yourself out, figure out what the rest of your life is going to be about, finding purpose, giving back. You've been very generous in participating in a lot of our caregiver support groups and strategies, and being a resource for us. I wonder if you might comment a bit about your thoughts. How did you sort of, pull yourself up by your bootstraps and say, I'm ready to start, getting myself out there again. I'm ready to start trying to give back. I want to take maybe perhaps some of the things that I learned and pass those on to others so they may be a little more successful. But would love to kind of hear your perspective on the things you're doing and how you got to that point.
Okay, sure. I guess, I mean, I'm happy to do that, but again, as you sort of prefaced it, and I think it has to be repeated, is that everyone, no matter whether your loved one's death is sudden, out of the blue, or a long illness, where you can see it coming, it's just a matter of when. In either of those situations, it's still a shock, and the grief has to be dealt with. And the way any particular person handles that grief, can't necessarily be anticipated. So each person's ability to take so-called next steps, is very different. So, turning it back to me, what have I realized about my own situation? And what am I doing about it? The first thing, that I, again, have to point out, which hopefully, most people have, but I know they don't, is that I'm very fortunate to have a loving daughter, a son-in-law, and 2 grandchildren living just down the street, 7 houses away. So, that's tough to beat when you're trying to, have a feeling of support. I have also have a caring son, daughter-in-law, and 2 additional grandchildren. One of whom is just about 3 weeks old now, living just outside Atlanta. That I have seen and have the ability to see quite regularly. So again, with those. With those capacities, that gives me a leg up, really, I think, in terms of dealing with my situation. I also have, a few close friends. I'd say not that many, but a few. So the question is, what am I missing? Basically, you realize after being married 50 years, but you don't have to be married 50 years for the same situation to be true. Basically 90+% of the people I know well or casually are couples, so I'd say at least subtly, those relationships have changed. There are, I'm sure, various reasons for that, but somebody was saying to me last week, that many people, especially those that you're casually friends with, maybe you've gone out to dinner with or gone to the shows or whatever it is, are uncomfortable knowing how to deal with you, what's the right thing to say, whatever it might be. But I mean, even if you do maintain, relationships with those people, again, it's a different situation than it was before. Bottom line then, my new reality is different, and I felt and feel a need to find my own path. I think, as you can see from the discussion even so far, I'm not just somebody who sits back and lets things happen. I mean, I'm a go-getter or something, however you want to put it. Basically, I'm willing to put myself out there to have new experiences, to volunteer, as I am with the MMC and other groups as well. And in the process, to meet new people that hopefully have common interests, that I do. I find that easier. For example, the things that I'm, involved with are, well, since we have had such good weather here for the last number of months, they're mostly outdoor activities, and also because of COVID as well. So hiking, kayaking, golf, those sorts of activities are ones that I'm, either interested in or have been doing. And, I'm finding new ways to meet people doing those things. A few months ago, I came across something called meetup.com, which I had never heard of before, which is an app. Basically, it's comprised of different affinity groups that people organize on pretty much any subject you might think of. Just here in the Charlotte area, there are literally hundreds upon hundreds of these groups. Whether they be for sports activities, for playing board games, for writers groups, for widows and widowers, for pretty much anything you can think of, or and if it's not there, you can set it up yourself if you want to. Just through this app, you can create a group, and most of them are free. Those that do charge something usually have a period of a trial period of 30 days or whatever, and you can join then, usually for like $10 a year. So it's really inconsequential. So you put yourself out there, you sign up for these events, and you go do them, and you meet people, and hopefully you make some connections, and so that's essentially what I've been doing for the most part. Also, just in terms of the hiking, I live in Fort Mill, and I don't know how many people out there on the call know anything about Fort Mill, but basically the crown jewel of Fort Mill is the Ann Springs Close Greenway, which is like 2,000 plus acres of hiking, biking, and equestrian trails, amphitheaters, dog park. I mean, it goes on and on. And they have a hiking club that puts on maybe 15 plus hikes a month. Just, find out where they are, and you go meet them, and you go hiking, and you meet people that way as well. And if you do, then you might, see those people privately to go on hikes or do other activities as well. Volunteering is the same thing. You find, something that you're interested in, like, MMC for me, or after the COVID shots became available and I had both of my shots, I started volunteering at the mass vaccination clinic down in Rock Hill here, until they closed because there was no need for the venue anymore. So, it's basically putting yourself out there, either as I described, or, through groups that you're members of, religious groups, is certainly a good way to go. Certainly some of my good friends and new, and acquaintances, I've deepened those through, the religious practice that I have. And, so you just got to find your own way and be willing to put yourself out there. Years ago, I remember my college roommate's father's wife passed away, and through his church, not at his church, but through his church, he started going to polka dances, and he met his next wife there. So there are many different ways to approach it, but you have to be willing to put yourself out there. There's no alternative to that.
Well, Roy, thank you. Thank you so much for sharing. I think one last story that I'll share before I hand it back over to Boyd, and then we can get into some Q&A. And I know, Janet, you want to talk a little bit about Southminster. But during COVID, of course, our office shut down for, a period of time. And I remember communicating with Roy about some things that were going on, and Wendy was having these movements, and we're not sure. And it was just too hard to try to figure out over a virtual visit or even the telephone, or however we were trying to do it. And they were Roy and Wendy were kind enough to welcome me into their home. I stopped by and then made a house call, and got to see Wendy in her own environment. And again, she was showing me all the family pictures on the wall, and that was great to see. But one story that was shared with me, which maybe kind of solidified why I have so much respect for Roy, and maybe why this connection is so strong, is they were sharing how at one point Roy worked for the large the large firm with all the, with all the stability and all the protections and whatnot, but he felt like he wasn't getting the personal touch that he wanted with his clients. And he made a big leap of faith, and he left the big firm and went out on his own. And hearing that story is right around the time that I left the big, the big house, the big medical institution, and joined Dr. Edwards and Dr. Chaconis, in this small sort of a nonprofit outfit. And it was a sort of a nice parallel, but it was really interesting to hear Wendy's perspective on that. And I was fortunate to have had the same level of support that Wendy gave Roy at that time from my wife Jennifer, and so that was another parallel that was there. But again, just loved being able to help serve Wendy. She was an amazing woman, and Roy, you did an amazing job advocating for her. So thank you. At this point, Boyd, I'll hand it back over to you, and we'll kind of get through the rest of the program into the Q&A. And I see a lot of familiar folks on here, and if you don't have questions, I might call on you because I can see you.
I mean, as I suggested my introduction, very fortunate to have family nearby and so on. I was able to get out a couple of times a week to play golf with the senior group and occasionally for other things as well, because my daughter was around. She also had an au pair at the time that we were able to to call upon. The other interesting thing that she did, this really, I think, speaks a lot really to Wendy as well as my daughter, and my, is that, a number of our friends here, really were and are my daughter's friends. I mean, they're, 20, 30 years younger than us. So they're, a somewhat different generation, but, the women particularly, but, the couples as well, just love to talk to Wendy and so on. Whenever they saw her, we always attended the functions at Laura Bree's house and so on. So Laura Bree actually put out, what they use for the, the kind of the meal train kinds of things. People can sign up to bring meals to people who, were in different situations. So she, basically set up a list, put up a list that people could sign up to come by for an hour or two, to just chat with Wendy. It wasn't, Wendy didn't view it in a negative way, which was fortunate. I mean, it wasn't, like people coming over to, to just, babysit her or anything like that. It was to come over and have a chat and a coffee and maybe, play a game or do a crossword puzzle or, do some some sewing together or whatever. So, that went on for a number of months, especially during, not during the worst of COVID, obviously, but, before we went into COVID and, as we were, things began to ease off, that took a lot of the pressure off me, very honestly. But again, I don't think most people would have, or I think many people, have the same thing in terms of, friends, family, other members of their churches or synagogues or whatever. People will be willing to do that sort of thing, but, they don't know how to go about it themselves. So, if somebody puts it together, it can be, a nice support, can give the caregiver, some time away. And that's really all you need. You need to be able to rejuvenate yourself, as you're kind of suggesting. And because, otherwise it's a 24/7 kind of a thing. Thank
Mark,
you.
that's a great question, and this is part of what we like to do at Memory and Movement Charlotte is what we call a care plan visit, and this is somewhat new to my side of the practice. This is something that's always been done on the memory side of the practice, but a care plan visit is actually a visit with the caregiver, the care partner, if you will. So the patient doesn't necessarily have to even be there. And that's a 1 hour visit. It can be done live or virtually, but it's a visit in which all of the different concerns of the caregiver are addressed, whether it ranges from safety issues, are there firearms in the house, is someone at risk for falling for different scams, are there, do we worry about leaving the stove on, those kinds of things. Have all the legal documents that need to be taken care of been done, whether it's living wills, power of attorneys, all those different things that we all have to think about, but also just addressing caregiver stress as a whole, identifying different resources, whether it's counselors, therapists, whatever it is. And so again, this is something that has been relatively new for my side of the practice since I've joined. But more and more, I've been referring, my care partners, if you will, for these visits. That can be very helpful. So again, something that we try to do, again, pay a lot of attention to the care partners, because as a few people on this call will attest to, when our caregivers get sick, we're in big trouble. We need to know what the plans are, what are the what's the crisis prevention plan, and that's something we want to be proactive about. So thanks for bringing that question up, Mark.
As I was transitioning more and more to the caregiver role, taking charge of the medicine preparation and any number of other things. And Wendy was resisting. I mean, I always knew I was in trouble when in response to my request, that she do something, she would say, "Okay, boss," that was not a good sign. Anyway, I was getting some of that, more of that, and I didn't really see myself as able to change my approach. I mean, sometimes how you handle things is how you handle things, and your approach is the same every time, or seems. So we were having some tough moments, and I could definitely feel that there was some tension building, and I spoke to you, and you suggested that maybe a session or two with the then Dr. Shepard at your practice might be helpful. And she really gave some very good suggestions, which I'd like to share with people here, because I think it might be useful. The first thing I guess I should say is that while I went in there hoping that I might give a little, or adjust my approach a little, and she would adjust her expectations a little. Basically, it boiled down to me adjusting. There was, she did not hold up. Dr. Shepard did not hold out much hope that Wendy would give much at all. So so that realization was number one. But the point is that, and her main suggestion was, we need to find ways times during the day to get away from the patient-caregiver relationship and back to the husband-wife, best friend, lover relationship, and to find ways to do that. And so we talked through, various possibilities, go out for a walk, in good weather, have a picnic, look at photos. In our case, we were both in community theater, watch CDs of our performances, look at videos of our trips that we took, And actually, the most interesting one was to take some virtual tours. This was again during COVID, and I realized after doing some research that there were museums and other locales that you could visit virtually. So the most exotic one, if you will, was we took a virtual visit to Machu Picchu, and which was good at the time and also saved me a lot of money. So anyway, so I think everybody can, think about trying to find opportunities to get outside that and that patient caregiver situation, and just by doing that, I think it gives you a breath. You can take a breath while you're doing that, and even if you're not physically separate, it's a different dynamic in the situation, which is a much more comfortable one for everybody. And that's, I think, something everybody should pursue if they can.
I had the same conversation, Roy, with the family today, where the spouse was, I could tell she was, really overwhelmed with, what she was trying to accomplish and what she was trying to do. And I said, why don't we try getting a little bit of help at home? Let's find a good caregiver who can come in for a few hours every day to do certain things. And she felt like, well, that was admitting defeat. And I said, no, this is, if you have someone who comes in and, does the bath, gets him ready for the day and does a few chores around the house, and then you can come in and you can be his wife again, that goes a long way. And so thinking through, how do you take a break from that caregiver patient relationship and get back to being, husband and wife and best friend, or, whatever the relationship is. So I think that was a great point. Let's say the honeymoon period, we're early on in the first, couple of years, really no matter, what medicine we try, it tends to work pretty well. The symptoms are mild, the medications work pretty well. After 5 to 7 years, so as the disease progresses, sometimes we see, fluctuations in the symptoms. Sometimes we see that the medications aren't working quite as well as they used to, and we have to adjust and do some different things. But it's not a hard and fast 5-year rule. It's just, at some point, as the disease progresses, there are fewer and fewer dopamine, neurons in the brain. That doesn't mean that we can't continue to help with different strategies, with different medicines, with adding higher doses, with changing what we're doing, with surgeries, with a lot of different things. So again, back to the original point of, when people can bring us data, here's what's happening when I take my medicine, this is what I notice that's good, this is what I notice that's bad, this is how long it lasts, this is how long it takes to kick in, those kinds of things. And we can, there's so many treatments available for Parkinson's that most of the, I would say even the general neurologists may not even know about, because there's such niche drugs. And folks who have to take care of people who've had strokes and seizures and Alzheimer's and ALS, and it's hard to keep up with everything. I mean, I'm fortunate because I can focus on Parkinson's, and I'm pretty simple-minded. If I had to take care of more than one problem, I don't know if I'd be good at it. But there's so many treatments available, and I look across the Zoom board here, and I see folks where they're rescue medicines, there are inhalers, injectables, there strips that melt under your tongue. There are just so many different treatments. So really, it's a matter of come to us with what those issues are. And more often than not, there is a solution. It's almost impossible to have an original problem at this point. We've seen it in somebody else and have learned from them. So it's not that it's a hard and fast 5-year rule. It's that, over time, things change. And we just have to know, how do we adjust and how do we come up with a different plan for what's in front of us.
I might just have one more quick comment about medicines, which, is a problem, an issue for everybody. I mean, for Wendy, it was really, got to the point where it was very challenging to manage. I mean, I mean, she was taking, around 50 pills a day. It's hard for me to even say it, to be honest with you. Most of those, the majority were direct Parkinson's, pills, and then there were, a whole bunch of other things as well. And we tried for a period of time to work with, I forget what they're called now, but basically the service where they prepackage the medicines, by day, by dose, and so on and so forth. And on the face of it, it sounds great, but we were honestly, disappointed in how it turned out. Number one, because some of the medicines couldn't be part of the program for whatever reason, so we, still had to put those, into the into the pill pack, the pill cases every day. And then whenever you wanted to make a change, even minor changes, they'd have to go back to the doctor and get his approval to do the simplest thing. If we wanted to change the timing of the dose an hour, and to separate medicines, it had to go back and forth. So, obviously people who are in a simpler situation than we were, it might be helpful, but, our experience was not great with it. So ultimately we had every day, we put her daily medicines in one, pill container, and we had, 7 a week, 7 of those for every week. So it was quite the process, but we worked it out, and sometimes we did it together, which was a good thing as well. So you make work what you can.
I did want to just thank Southminster, of course, well-known long-term care community who in the area, Charlotte area, also has a very highly regarded home care company, and they have generously offered to be our sponsor for the sessions this year so far. And Thomas Brewer, who is Director of Development, was not able to be with us tonight, but will be on future sessions. But I just wanted to thank them again for their support. They are an absolute tremendous community partner, not only to Memory Movement Charlotte, but to many, many nonprofits in the Charlotte community. So thank you, Southminster.